International Rescue Committee has warned that up to 1 billion people could be infected with coronavirus across crisis-affected countries. I spoke earlier to its chief executive, the former Foreign Secretary David Miliband. He told me that the virus could claim as many as 3 million lives around the world.
We've studied the 34 fragile and conflict-affected states where the International Rescue Committee works. We know the struggles that exist in advanced countries like the UK or the US. But in these conflict-torn states, using very conservative estimates on the infection rate based on the Imperial College and World Health Organization data, based on an assumption about Chinese levels of hospital and healthcare, which is really very generous given the levels that exist in conflict-affected states like Yemen or Syria, we've found that the coronavirus is going to affect between 500 million and 1 billion people globally in these 34 countries, and that the death toll could number up to 3 million, between 1.5 and 3 million. And so our call is to say that we have only weeks to prepare for this disease to go on the rampage in some of the poorest countries in the world. And as the debate about lockdown develops and how to end it develops in countries like the UK, we need to make sure that we recognize this disease is a global disease that will only be fully beaten when it's beaten everywhere.
Now, this at the moment, it's a dreadful prospect, but it's only potential. What is the extent of coronavirus infection as far as we can tell in these 34 countries?
Well, we know that coronavirus is now everywhere. We also know that the testing regime, for all the problems that exist in the UK or the US, the testing regime is threadbare in countries like South Sudan, in countries like Nigeria, in countries like Pakistan. And so the official toll at the moment, which in Africa they're estimated, according to the number of tests, is about only 25,000 cases across the whole continent of Africa, more than 1 billion people. We know that's a massive underestimate. What we can see is that step by step, there are more and more people coming to our health centers that we run around the world. And so we see this disease really taking off by around mid-May. And so we can see it creeping forward. We've got a few weeks left to do some essential precautionary preventative work. That means very basic hand washing stations. It means triaging people by testing them for fever and isolating high fever cases. But we're going to also have to build up the health systems because there's going to be an enormous number of people who need basic therapeutic care.
And where are the resources for that going to come from?
Well, the resources are going to have to come internationally. One thing that we've discovered in the last few weeks is that obviously countries like the UK, the US, they found money when they needed it. And our point is that as a matter of morality, but also as a hard-headed matter about how we return to anything like normality, we're going to have to fully fund the aspirations of organizations like the World Health Organization. The promise of the Trump administration to cut the World Health Organization budget is the opposite of what's needed. We also are going to have to make sure that in countries like South Sudan, where there's 4 ventilators for the whole country, we're not going to save lives by getting ventilators in there. We're going to save lives by getting much more basic infrastructure into place so that people can prevent the disease through hand washing, through proper information, through a modicum of social distancing, but also by isolating cases so that they don't spread across the whole population.
So if the World Health Organization were to be funded fully, and most of its members do fund it, would that be sufficient?
Well, the new appeal details haven't yet come out. We're going to know next week the Global Humanitarian Response Appeal, which is jointly being done by different agencies across the United Nations. So we don't yet know the full scale of their appeal. But certainly the underfunding that is promised by the Trump administration is completely retrograde. It would damage some absolutely vital programs, not just in respect of COVID, incidentally, but also in respect of other matters. 27% of the US funding for the World Health Organization goes into eradicating polio. So there are other health conditions. And we've made the point that there's a double emergency in lesser developed countries, in countries where there's a very weak health infrastructure. Yes, there's a health emergency, but there's also a social and economic emergency looming as well, where the weakness of the overall economy means that the emergency is doubled for these very vulnerable populations. And so the sooner we get on with the preventative work, the more we can mitigate both aspects of the emergency.
What do you say to President Trump's suggestion that in warmer places, the virus may pose less of a threat?
We don't have any evidence for that at the moment. There are warm places that have had the disease. Remember, in Australia, it's been summer over the last 3 months, and they've had the disease. So I don't think we can rely on the weather to sort this disease out. It's hit countries warm and cold. It's hit countries democratic and autocratic. It's hit countries north, south, east, and west. It's a genuine disease of the connected global economy and society. And we'll only attack and push this disease back if we do it everywhere. It's the holes in the global safety net that are the biggest part of the problem.
There's also been a suggestion that in countries where sanitation is less good, the population may have a bigger inbuilt resistance to things like this.
That's certainly the case on one side of the ledger, but on the other side of the ledger, countries where there's high levels of malnutrition, where there are weak underlying health conditions, are more vulnerable. So it swings and roundabouts on this. That's why we've given a range of 500 million to 1 billion estimates of infection in our report. We've also given the range for the number who will eventually die, between 1.5 and 3 million, because it depends on our response. And of course, there's a lot that's uncertain about this disease. But what we do know is that if you can't wash your hands, if you've got high levels of malnutrition, if you don't have a functioning health system, your vulnerability is all the greater. On the other side of the ledger, of course, if you've got a youthful population, that may help you. But the vulnerability, the danger for people around the world remains very high.
Now, on this question, you obviously are trying to provide some leadership, but if we look at national governments, you're critical of Donald Trump, but do you see sufficient global leadership coming from elsewhere?
Well, not at the moment, no. I mean, it's to state the obvious. This is a global disease that's being fought nation by nation. Now, the UK has taken an important step in convening a group of countries to help think about the distribution of vaccines when one is finally discovered. That's a good thing, but we need much, much more of that. At the moment, the group of 7 leading industrialized democracies haven't even managed to agree a joint statement. The group of 20, which is currently led by Saudi Arabia, which is the 20 largest economies in the world, that is in a slumber. That's the only way to describe it. And the global nature of the disease is not being matched by the kind of international cooperation that is going to be essential. We can also see a looming battle where you can see countries like China, autocratic countries, authoritarian countries, saying they've dealt with it better because they're authoritarian. There's no evidence that that's the case, because after all, democracies like Germany and South Korea have done well. But I do think that these contests about the lessons of the disease are being started now. The debates about the lessons of the disease are being started now, and they need to be joined by real action.
Do you see China also trying to exploit perhaps an illegitimate opportunity for global influence in this area?
Oh, undoubtedly. Every country wants that's thinking strategically can see that there are global
China's a superpower, and as you say, an autocratic one.
Yes, I think that you can see both in the benevolent actions that China is taking, for example, in the distribution of humanitarian aid, but also the tougher line they're taking in their own sphere of influence in the region and in their own country, or the way they're cracking down on dissent. You can see there's a two-step being practiced. And my point is that we shouldn't be declaring a Cold War against China. That would be a retrograde and thing to do. It wouldn't be a wise thing to do. But we do need to rally the world's democracies to work together so that they can negotiate, compete, and cooperate with countries like China on something like an equal basis. Because given the size of China, you're right, it is an emerging superpower. But if you balance that with the scale of the European Union, 500 million people, plus the UK, plus the US population, you've got some kind of balance there. And I think if the democracies of the world don't cooperate, they're going to be on the back foot when it comes to a more confident China, which we're undoubtedly seeing.
But what does it say that the United States, which has been the leader of the free world for at least a century, the biggest economy in the world, the most advanced society, what does it say for democracy? The United States is also the worst hit country.
Well, it says that there is a high degree of dysfunction in the way the American response has been organized. Some of that is built into the separation of powers between national and federal and state authorities. But obviously, there's also the degree of polarization that has created the massive level of mistrust that exists across the country. Here, I'm living and working in the US. I'm obviously a British citizen, and I see a high level of polarization and mistrust. And one of the things that we know about this crisis is that it requires high levels of social trust for an effective response. Countries like South Korea and Germany have shown that. The rallying that's happened in the UK to support the National Health Service, 750,000 volunteers, that speaks to social cohesion. We're not seeing that in the US at the moment, even before you get into the absurdities of last week's discussion about bleach and its ill effects. And so I think that there's a big question now that America is going to have to confront. How does it combine a more effective domestic response with a reassertion of international leadership? And in an election year, that needs to be a big part of the debate.